Hello, everyone. My name is Eduardo Huesca, and I work for the Occupational Health Clinics for Ontario Workers, and I am the coordinator for this project that we'll be discussing today. So this project brought together a great team of people, some of whom will also be presenting today, including Stephanie Mayel, Cynthia de la Mora, and Christine Khalil. And we've also put together more detailed bios of the rest of the team that we'll include in the slide deck that we'll share after the presentation as well. So in terms of this project, the main goal or focus was to create an inventory of mental health and psychosocial well-being supports and services available to international agricultural workers in Ontario, and to distribute findings to these workers as soon as possible during the 2021 season. So this project was identified, or sorry, this priority was identified by the project funder, the Ontario Ministry of Agriculture, Food and Rural Affairs. And the project can be conceptualized as a rapid response project in the context of mental health, health issues and needs during the COVID-19 pandemic. So in addition to sharing findings from the project service and support scans with IAWs, we also sought to better understand key issues in more depth. And therefore we conducted a scoping review of literature, of scientific literature. So we actually reviewed 160 English peer-reviewed research papers and 20 Spanish language peer-reviewed research papers. And we also conducted structured interviews with 26 Ontario international agricultural workers, as well as with additional stakeholders, including 20 community support groups working with these workers, 7 employers hiring IAWs, 2 employer associations, 70 community group health centers seeing IAWs as patients, 1 Ontario mental health organization, 3 mental health initiatives specializing in work with migrant communities, and 4 representatives of 3 Ontario legal clinics. From all the findings of the project activities, we've identified some promising practices supporting the mental health of Ontario IAWs, and we've also identified important gaps and recommendations for intervention. So in terms of today's agenda, we are going to review our regional service and support scan and resource poster activity, again, because this was the core of our project. From there, due to concerns for time, we'll go directly to presenting our promising practices and then our gaps and recommendations. So although all of these draw from the stakeholder interviews, we will not go deeper into the interviews as part of the project, or part of the presentation, but we can do so during the discussion period if there is interest. And we really suggest reviewing our interview sections in the final report as well, because IAWs and additional stakeholders interviewed really provided a lot of important experiences and insight as part of those sections. And noting that the project took place from May 2021 to March 2022, and the final report has been circulating, but we can also share it as part of these slides and then in the chat of the presentation as well. In terms of the theoretical framing of the project, it was developed under 2 conceptual frameworks, the social determinants of health and occupational health and safety. So the social determinants of health are the social and economic conditions that shape the health status of people along their lifespan. And this framework demonstrates the ways social, economic, and political factors such as income, immigration status, education, work, housing, gender, race, and ethnicity influence individuals' physical and mental health outcomes. The OHS framework focuses on work environments and human activity within these environments, and both frameworks emphasize prevention through the design and implementation of policies, strategies, and interventions at the socioeconomic and workplace levels. So a couple of project limitations that we just wanted to identify. So initially the project was intended to engage with Latinx IAWs, as well as Caribbean IAWs, as well as Thai IAWs, Thai community IAWs. At the initiation of our project, our Thai community outreach worker had to take a leave of absence, and we were unable to connect somebody else to our project team. So therefore, we didn't have the capacity to outreach, connect, and communicate with Thai IAWs, which are a growing population of workers in agriculture in the province. So the project really wasn't able to capture the experiences of these workers or the insight from community groups working with them. Similarly, the project wasn't able to capture the experience of other country IAWs, which we know the numbers are increasing among workers from other countries as well. Another gap was, although one of our project interviews with IAWs was an interview with a woman coming under the program, our project really didn't explore the particular experiences of temporary foreign agricultural worker women, and particularly their experiences, stressors, hazards, and mental health and their needs. So that's definitely a limitation and gap that we see as well. In terms of transparency, we just wanted to put it out there that, our project team was brought together really among people who are actively working in this area and are involved in initiatives and work in this area. So at different points in our project, we review initiatives or work where some of our project teams are involved in. And in no way is this meant to be any type of self-promoting, but it's just comes with our team being quite active and connected in this work. So getting started in terms of the regional scan and poster activity, the activity's focus again was to identify community supports and services available to Latinx and Caribbean IAWs in Ontario that are protective of their mental health and psychosocial well-being, that may help prevent and address factors that can put their mental health at risk, as well as supports and services that can help individual workers facing mental health challenges. So in total, we looked at 8 Ontario regions for our scans. These included Bradford, Brantford, Brant County, Durham Region, Haldimand, Norfolk, Hamilton, Carlisle, Linden, Niagara Region, Sarnia-Lambton, and Windsor-Essex. These regions were selected by looking at available data on the regions with the highest numbers of IAWs living and working, and the smaller regions were selected based on our project team's connection to other workers or community groups in these regions with smaller numbers. And that idea was so that we could, land and proceed a bit faster in this FASTA project based on those already established connections. The scan itself consisted of internet-based research and review of secondary data related to service and supports for IAWs in Ontario, as well as extensive engagement with known regional stakeholders and support and service providers to clarify information on known supports and services, but also to help inform and refer us to other services and supports that we were not aware of. So following a snowball or chain referral sampling technique. In the final report, we go into this a lot more in detail because it was quite a lengthy activity, was quite labor intensive in terms of connecting to a lot of organizations and verifying information, translating information. But basically the activity itself resulted in identifying 89 organizations, services, and supports available to Ontario IAWs. And this inventory of these supports and services was completed on June 18th, 2021. The supports and service information across the 8 regions were organized in 3 categories. So the first category was community connections and support. So this included organizations and community groups providing opportunities to workers to connect, socialize, build community, including faith-based communities, and recreational events and activities, but also these community groups are actively providing essential services to low-resourced workers. So, for example, food, toiletries, clothing, kitchen equipment. These community groups are also actively helping workers connect to additional services, including healthcare services, as well as helping navigate through government processes and procedures. And this was very active during the COVID-19 pandemic. And also helping workers navigate through reporting channels. In the category number 2, healthcare services, are health centers and clinics specializing in services for IAWs, as well as other services that were identified to be more or less accessible to IAWs. Pharmacies were also identified that could provide guidance to workers. Sexual health clinics doing outreach work were also included here, as well as a telehealth Ontario number as well. And then the third category, getting help for stress and worry, focused on services and supports focused on mental health. And they ranged in mental health promoting services and programming to responding to the needs of workers experiencing mental health challenges. So the information from the inventories were laid into a template for posters, and a poster template was, or poster format was selected. And this led to then the creation of 8 regional posters, both in English and Spanish, that had then digital and print copy versions to them. So here's just a quick example of one of the version 1 posters that we came up to, that was the outcome. So you can see a bit of what this looked like. In terms of the distribution of these resources, starting in June 30th, 2021, we distributed all posters electronically to 45 support groups and service agencies across Ontario, as well as 10 sending country consulate and liaison services, and 2 agri-food sector associations. Really quickly we received feedback and requests for edits and additions to the poster information from 18 stakeholders. So we quickly addressed and made those edits, and we re-released the posters starting in August 16th through a PDF that contained all of the poster links in that one promotional document. During this time, stakeholders assisted us in disseminating the poster links. So community groups put the posters up in Facebook groups with workers. Employer associations put them up in on websites, resource websites for employers. And we used Bitly tracking, a click tracking program. So as of March 8th, 2022, clicks across all version 1 posters totaled 528 clicks. We also printed 200 English and 200 Spanish posters of the copies of the version 1 posters and distributed these directly to IAWs. As we discuss in our report, the in-person distribution of printed posters was really challenged by the pandemic, COVID-19 pandemic, and there was very little opportunity to engage with workers directly, as well as with community groups directly. So we definitely encountered shortfalls in distribution, but in September, there was an improvement in COVID-19 cases and an opening up of activities, and that saw some community events organized for migrant workers. And so our team members traveled to various regions, and we did participate in activities directly providing the posters to workers. Also, stakeholders let us know that they themselves also provided printed posters to workers. So we had a community health center note that they printed posters and provided to a church group who delivered them along with some food deliveries to workers, and a health department in another region noted that they printed posters and left them as part of their housing inspection. So they distribute them in worker housing. So our project really sought a lot of opportunities to provide feedback on the posters, both so that we could potentially have the opportunity to improve the posters within the project timeline, but also just to continue building our understanding around resources and distribution strategies for these communities. In addition to the 18 stakeholders that I mentioned that provided us feedback really early on, we also included questions around the posters, feedback questions around the posters in the project interviews that we conducted with Ontario International Cultural Workers, as well as additional stakeholders. So in our final report, we go into the methodology of these interviews in a lot of detail and a lot of other findings beyond the posters, but here I'm just going to really touch quickly on some key examples of feedback we received from workers and additional stakeholders. So here we asked workers whether they found the information on the 3 poster categories useful to them or their coworkers. And generally we saw that workers identified that this information was indeed useful to them. And again, in the final report, we go into this in a lot more detail, but just some of the themes that international agriculture workers shared with us about the importance or the benefit of this information. The benefit of being informed about community supports and services in case need arises. And we saw responses specifically looking or mentioning in case of injury or illness. And we're going to get into this a little bit more later on, but the theme of workers being concerned or feeling at risk for injury or illness was definitely a theme that came up repeatedly in the interviews. Another one was the benefit of being informed to increase independence in seeking support and services and service access. And again, we saw responses specifically mentioning the benefit of being informed to not depend solely on their employer to access services and supports. As well as then another theme was just generally the need for information due to a lack of knowledge and information not being shared with workers. So one worker, it's a quote here, we included one worker noting, this information is very helpful since when we get here, we don't know anything and the farm becomes our little world. Knowing about organizations is important to help us know and learn more in general. In reality, there is not much dissemination of these services and organizations among the farm workers. I think that the organizations that are offering these supports and services, should work more in that area. We also asked workers about other topics of information that they were interested in receiving information about. So this bigger table identifies some of that. So information rights in Canada, accessing permanent residency, information about benefits, legal support. We also asked workers about the preferred resource format for information. And you can see that video, audio messages, posters saw the most responses. We also asked these questions to the stakeholders, support stakeholders as well, and that's also in the final report. We also asked workers for feedback on the distribution strategies to reach them and their coworkers, and we saw a significant number of answers identifying sending information through WhatsApp, through the WhatsApp phone application. So this is something that more and more organizations are identifying as a strategy to get information to workers. Within the project final report, we get into this a little bit more because some workers did identify concern with making sure that information resources are able to be opened through the WhatsApp phone app, and a couple workers let us know that our posters, they had difficulty opening them in WhatsApp. Other workers obviously noted that using WhatsApp depends on them using their data or being connected to the internet, and one worker, for example, noted that he didn't have access to internet and had to travel to a Tim Hortons to access the internet. So so there's more to this than meets the eye in terms of making this effective distribution strategy. So again, we sought feedback on the posters from the other interviews with other with other stakeholders that are listed here. I'm not going to get into that too much, but basically, some really positive findings, and I'm going to get into the limitations that people let us know about in terms of resources, but positive findings included that the posters included new information for a lot of these stakeholders. So information about services that they didn't know actually existed in the regions that they work, and that the posters were identified as a useful tool for these other support stakeholders to then help them refer workers to other services. Specifically in terms of the new information, a lot of organizations were not aware of the mental health category resources in their regions. And then other positive feedback included that the information identified on the posters was correct and thorough. So after the distribution of version 1 posters, the feedback, as well as completing the additional project activities, including the literature review and full interviews with workers and stakeholders, we decided to update our regional posters to try to address some of the feedback we received. Unfortunately, we were not able to address all of it, especially the formatting feedback. Again, videos were identified as the most preferred format, but just the timeline of the project didn't allow us to start from scratch around these resources, so we decided to build on the posters. But we did incorporate some video links in the actual digital formats of the posters. For example, there's a WSIB video that's embedded into these posters, different videos. We really did try to leverage videos. And we also created 5 English and 5 Spanish videos that are meant to be guides discussing these posters in Spanish and English and helping workers navigate information. Also, these new posters included 7 new services under 2 new categories, including workplace health and safety and reporting situations of abuse or emergency. We created a new regional poster for Prince Edward County, and the Legal Aid Ontario toll-free number that connects callers to their closest community legal clinic was also included across all posters as well. And then lastly, in terms of just the limitations and shortfalls identified of these materials from stakeholder interviews, again, accessibility of poster formats, we understand and stakeholders let us know that, some workers experience literacy barriers, so the text heaviness of the posters could be a challenge. Design and formatting was also identified as maybe benefiting from some rethinking. Ensuring resources actually get to workers was a big issue too. So we ourselves obviously experienced distribution challenges, but even among networks that we connected to that themselves talk about being well connected to workers, they themselves noted that sometimes they're realizing that they're not actually being able to reach all the workers in the region. So there's definitely an issue around complete reach to workers in particular regions not really happening throughout. Ensuring contact numbers lead to accessible and effective support. So that was a really good point in terms of giving a phone number, but ensuring that the person answering that number understands the experiences of IAWs, the risk factors, and can help contextualize the types of services and supports they're providing. lack of supports and services in some regions. So we were challenged to find some services in the category. So for example, primary healthcare services in some regions, we had a hard time identifying accessible points of contact to primary healthcare services for IAWs. So in some regions, there wasn't the services that we think are needed and that workers identified that they're looking for. Limited resources among supports and services. So among even the services that we connected to, some of them spoke about being restricted to their reach or their capacity. And then the last one is services and supports and the idea of structural change. So again, this was really focused on the idea that, of course, it's important to assess and place attention to the availability of supports and services, and that this is valuable, and we need to kind of actualize access to these important services, but it cannot be divorced from continued recognition, understanding, and work to address the various structural factors that cause harm to individuals and communities. And in the context of IAWs, to understand the ways poverty, immigration status, work and housing conditions, racism and discrimination are all intersecting determinants of ill health and harm. And just the idea that, a response to these social determinants needs to be incorporated into policies and practices that actually seek to improve primary mental, psychosocial, public, and occupational health outcomes for these communities.